Welcome back. While we did see progress in late spring when it came to COVID-19 cases, hospitalizations, and deaths decreasing, summer has seen a rise in all of those numbers again. Today, we are talking about lowering your risk of getting sick and spreading the virus when you leave your home. Joining us now with some great information is friend of the show. Please help me welcome Dr. Jeremy Wigginton, the medical director for Blue Cross and Blue Shield of Louisiana. Hey, doctor.
Hello, good morning. Thanks for having me.
Thanks for coming on again. I'm wearing some Blue Cross Blue Shield blue this morning in honor of this interview because it is really important. It's no secret. COVID-19 in Louisiana is still running rampant. What can you tell us about the status of COVID-19?
Sure. Well, as we know, we had loosened some restrictions in Louisiana. We had moved from phase 1 to phase 2, and some restrictions had gotten lessened. But then after that, we saw rises in cases, unfortunately. We saw some increases in deaths. And so we do know now that the governor has, again, removed some of those liberal opening precautions. And so we've actually rolled back our reopening a little bit. And now we all have to wear masks all of the time when we're in public. And anytime we're outdoors, even when we're going to be within 6 feet of people. And so one thing we noticed when we went from phase 1 to phase 2 was that increase in cases. So we know that some of those things like going into bars, not wearing our mask definitely made an impact and caused those cases to rise. And so now we really need to step up and adhere to these new guidelines of wearing those masks all of the time.
And what's really interesting is that I'm going to call it the new wave is what we're seeing right now. A lot more younger people is the reason why we're seeing many more numbers today, right?
Right, exactly. We are seeing increases in numbers of those younger individuals, and we do think that some of those increases in the younger population is because of some of those reopenings. And so, again, we really need to follow the guidelines of state and government officials when they're making recommendations for wearing those masks. We need to respect those decisions for them to reclose some businesses and to make restrictions on bars because we do know for a fact that those things have caused rises in cases.
And I know you have been lucky enough to come on the show and tell us some of these COVID-19 precautions. Let's remind everybody, what are some of the precautions we need to take in order to not get COVID-19 or spread COVID-19 if we have it?
Sure. And the best things to do are not just one thing, but all of these things. Wearing that mask all the time that covers your mouth and your nose. It can be a cloth mask. The CDC website has a little video tutorial on how to make a mask yourself if you can't get access to one. You want to stay at least 6 feet apart from others, even when you're outdoors. You want to make sure you're washing your hands very frequently and not just doing one of these things, but everyone doing all of these things. And if you're going to use a hand sanitizer, making sure it's an alcohol-based hand sanitizer with at least 60% alcohol. Some sanitizers have other primary ingredients. Look for those with the alcohol ingredients. A lot of breweries and distilleries in town have actually started selling their own sanitizers, so you can look for those too. Really avoid touching your face. Checking your temperature frequently. Some businesses are checking it for you. If it's 100.4 or above, make sure you do not leave your home. Stay away from others.
And this is something we have talked about before, but we keep reminding people because this is something we need to do if we want to defeat this virus, if we ever will defeat this virus, because I know a lot of people still have doctor's appointments that they want to go to. What can you tell us about doctor's appointments? Is it safe to go to doctor's appointments?
Sure. If you have a need to go to the doctor's office, you've got to get your checkup, or you have other medical conditions like diabetes, high blood pressure, some chronic condition, you're on medication, it is safe to go to your doctor's office. Doctor's offices specifically are taking very good precautions in order to prevent the spread of the virus between patients. So it is safe to go to the doctor's office. If you need medical care, it is safe to seek care. Those places are specifically doing very aggressive measures to prevent the spread of disease, specifically the COVID-19.
Yeah, I went to the doctor a couple of weeks ago and they took great precautions. Wear your mask, call when you're in the parking lot so we can let you in. They really are trying to do the best they can, which I really respect. Before we go, I really want to help people understand the difference between the coronavirus and then just a general cold. What is the
Mhm.
biggest difference between a cold and the coronavirus?
Well, that's a really good question. It's not just a cold and coronavirus. What about allergies? What about other things that cause the exact same symptoms, runny nose, cough, sore throat? The truth is, you may not know. And that is really why we say if you are sick, stay home because you may not know what it is. You may not have a fever. The symptoms can range from absolutely nothing. So we know that there are people that are asymptomatic carriers, hence why we should all wear the mask. We also know that the symptoms vary greatly from just runny nose, cough, sore throat, to all the way to very high fevers and even having to go into the hospital because of trouble breathing. So if you are sick, the best thing to do, and you're not really sure what to do, talk to your regular doctor, give them a call. We also know that telehealth is an option. If you want to get some medical advice, look for a telehealth option with your regular provider. Blue Cross has Blue Care. Talk to a healthcare professional if you're not really sure. But
Very
again,
important.
we're sick, whether you think it's allergies, a cold, doesn't matter. Stay home and wear
Stay
that.
home and know your body. Doctor, thank you so much for joining us this morning. And hey, to learn more about the precautions you can take to protect yourself and others from coronavirus, you can log on to bcbsla.com/COVID-19.